Okay, thank you. Well, welcome to this master class. We are really excited to offer you this opportunity to hear more about how you might work with Avel eCare to help your school situation with regard to your health office, with regard to your families, your staff, and your students. If you're not able to find school nurse support, or if you think this might be a better direction to go. Our friends in South Dakota are using this system with great success. And I was told about this opportunity via Avel eCare staff, but also letting me know that South Dakota had been using the system for some time. And I really trust the executive director's judgment there and thought that it would be something that we should maybe look into. And me and I had a great meeting with staff and decided that we would offer this masterclass to you free of charge. And so it will be an opportunity for you to learn more about their offerings and then to ask questions. So I will turn it over to Avel eCare staff. And maybe I'm pronouncing it wrong. It could be Avel. I'm not sure, but I know they'll correct me.
Actually, Avel.
Avel. Well, thank you. My apologies. I'll try to remember that. Okay, thank you. Is this Sheila speaking?
It is. It is.
Okay.
So since we'll be working among a couple different platforms today, I'm not going to have my camera on so that we'll be able to do a demonstration in a short time. But thank you, Deb, for inviting us to come. And let me start with introducing myself. My name is Sheila Freed, and I'm the director of the Avel eCare School Health Program, and I've been in this position for about 6 years. And then I'll let my colleague Liz introduce herself, and then we'll get started.
Hi, my name is Liz Tefland. I am actually a school nurse that works in North Dakota. So we partner with Avel eCare, and I help implement the schools in North Dakota and assist the schools as needed throughout the school year.
All right, so we're going to start out telling you just a little bit about who we are and what we do, and then we'll move on to the demonstration. So we're really like a telemedicine hospital is what we do, with a reach of about 32 states. We've been in business about 25 years. And so we have a variety of services that we bring to hospitals and schools. So this service line started in 2015 and really as a pilot project between the Sioux Falls School District, and it's a district of about 25,000 kids, around 36 buildings, and they were just needing more support with their nurses. At that point in time, there was about 25 nurses that they had, and it just wasn't enough. And so that's kind of how this program was birthed. And really the principles of the telemedicine group is really to see how we can fill the gap and how we can help. We don't replace staff, but instead really work towards how we can enhance staff, enhance productivity and sustainability of our workforce. So what we do know is this slide just tells a little bit about school nurse coverage. There's not enough in many of our schools. And so how do we help fill that gap? We know that school nurses bridge the gap between the acronyms of education and the acronyms of medicine, and many times what they do is they interpret. They're the interpreters between education and medicine. I remember I gave this talk about last Friday to the South Dakota School Administrators Group. And one of my principals that I had originally about 18 years ago, actually in Sturgis, South Dakota, we were laughing because one of my first IEP meetings, they kept saying PSA, PSA. And I had just come from a hospital setting and I was thinking, all I could think about is that it has to do with the prostate. And then there's just a 7-year-old in front of me. What are we talking about? And so it's like as time has gone on, then we know, oh, there really is different language that is spoken, and nurses help to fill that. So like I said, I started out my career as a school nurse in the Meade County District in South Dakota, which is the third largest geographical school district in the nation. And so really, when I think about what we do, it was a solution to a problem that I had. And so I drove around 100 miles a day just to take care of my kids. And then I had 8 county schools, and they were the farthest one out was 90 miles, and I would go there a couple times a year. But my daily tasks took 100 miles a day, and that takes a lot of time out of a building and really decreases your productivity. So then we moved to Sioux Falls, and so I was like, yes, I'm not going to have to drive so much. But it was amazing because I had 3 buildings, and I could never be in the right building at the right time. And so I still ended up having this non-productive time as I would run between buildings, because there's something in the seats of children that goes off the minute the nurse leaves the building that says, I need to see the nurse. And so the staff, the staff are good in our buildings. They would call me, let me know. But sometimes what they told me and what I imagined was not really the same. We had different little algorithms in our head. And I can remember sometimes one incident where I was across town, I was called and said a student had fainted. And so it took me about 10-15 minutes to get there. I got there. And so I walked in, I'm assuming the student is fine. I hadn't heard anything else again. And so I said, so they're okay now? And then the answer was, oh no, they're still passed out. So I went running down the hall, yelled, call 911, because the school staff didn't know. They were waiting for me. And yet, if they could have pushed the button and I could have seen that child right away, we would have known that there needed to be more medical help than I as a school nurse was going to bring. So it really helps to bring that access to a nurse immediately. And sometimes the barriers are different. Sometimes it's because we have some school nurses, but not enough. Sometimes there's geographical barriers. We know about miles out here in the Midwest or our small rurals, or we know about our city schools where there still is plenty of need. But sometimes geographical barriers look different. So we have started in the state of Maine, and some of our schools are island schools. And so they only have access to the island by ferry 3 times a week. So they brought us in for a different reason. Sometimes it's related to funding issues. And it's just also having a nurse available so you can have the best care for your kids at the right time. And so, like I said, it kind of helps to fill the gap. That's what we really do. It increases productivity of staff. So if you have staff nurses in the buildings, but not enough, but that allows them to really focus when they need to focus, and allows others to work in partnership with them. And by providing the access to the nurse, and we really partner with the on-site nurses. And so how we serve the schools looks a little different in each school district that we serve. And Minot, North Dakota, we're in all 19 of their buildings. They have 5 on-site nurses. And so they have access to the school nurse immediately. And they had thought that really the middle schoolers didn't need a nurse, is what the common conjecture was, because they weren't calling the on-site nurses who were based out of the elementaries. But what we found out is it really was an access issue. So I can tell you beyond a shadow of a doubt that they call us a lot, and they keep us out of trouble. So that is a good deal. So, but what can telemedicine do, right? So it's really one push of a button and you get access to the nurse. And we do a variety of different intersections with the kids, from illness to concussion screening, accidents, injuries. We'll talk about it a little bit more as we do our demonstration. This is just showing you where we serve right now. The picture in the bottom left is a little school on a reservation in North Dakota. And then we have a school on Maine in the right-hand corner that is actually right on the ocean. This is just talking a little bit about how the program has grown. We received a federal grant in 2016 to take it to the rural settings from the Office of Rural Health and Telemedicine. That grant ended in 2020, and then we still have continued to grow as we have scaled up. So I really already talked about this, but really we have two different kinds of service that we bring, where we help with the nurses that are already there, or where we are the school nurse. So when we're the primary school nurse, we do the 504 plans, the care plans, we meet with the parents, we train the staff, we kind of do those wraparound services that you expect nurses to do. The other thing that how we've modeled our program, even as we've grown, is we've modeled it so the buildings have the same school nurse the majority of the time. And our chronic care kids, like our kids with diabetes, we always want to make sure that they have the same nurse so that they can develop that relationship, especially year over year. And it's a staff satisfier, and it's also a building satisfier, because then they know who they're calling. This is what the equipment looks like, and we'll show you a little bit more. So you get a little cart that goes into your building that's connected to your Wi-Fi. The equipment is easy to use, and in fact, last week I was on a visit and a kid had bumped his knee, and I said, can you move the iPad down so that I can see a little bit better, so I can see both your knees at the same time? And usually our helper is just off camera. And the little boy said, he was a 5th grader, he said, I don't know how to do that. And I said, is there a helper in the room with you? Is there a grown-up in the room with you? And he said, nope. And so we went, and I said, would you go get a grown-up for me, please? And so he went and got the office staff. They helped me do the assessment, as you'll see in a minute. But he had just pushed the buttons and had intuited how to come on with the nurse. The equipment was there. He had seen the nurse the week before on the equipment. It was so funny. It wasn't a barrier. And then I told him, well, I think that what our plan will be is we'll put ice on it for now. I'll let your mom know what happened, because he had told me that was the best grown up to call. And I said, how does that sound? So we're always teaching our students to be health consumers. And he said, that doesn't sound good at all. And I said, oh, well, how would you like the plan to be different? And he said, my mom is at work and she does not need to be interrupted. I will tell her when I get home. And so I said, okay, sounds like a good plan. And then I made a mental note. I think he's going to be our next CEO in it'll probably take him 30 years. I'm not sure, maybe 20. Anyway, he's a great kid. So this is really how the technology works. Blue dot to blue dot. It's simple. And we'll show you this. You'll get to see that in person. And so the interesting thing is no matter how good your technology is, it's really not about the technology. Now we have to have easy technology and we have to have good technology so we can make a good assessment. However, it's really about those relationships, with the school staff, with the parents, building nurses, and principals. And so we intersect with the kids in different ways. Sometimes we intersect with them, with animals, stuffed animals. Some of our littlest kids are 3-year-olds. And so they love to play with the animals or guess what the animals are that are coming on camera. Seems like our elementary kids love the knock-knock jokes. And then for our high schoolers, especially the ones with chronic needs, we have a special needs kids who's in high school. He happens to have diabetes and other impairments. And so he loves Johnny Cash. So if he's having a bad day, we know we need to bring the Johnny Cash out just to help with the engagement. So the school nurse is one of the services that we bring. One of the things that our schools were asking us for, though, is behavioral health services as well. So while school nurse is really a passive consent, behavioral health is an active consent, and is really where it's like going to the clinic essentially. And that's something that we really have to work together, and the counselors and the MSWs who are therapists work to serve the students together. All right, so it is demonstration time. So I'm going to stop sharing this screen and I'm going to share a different screen. All right, can you all see Liz now? All right. And so Liz is going to help me demonstrate how the equipment works. And so how it really works, what you're seeing right now is my screen. And then what Liz is showing you is the Tidal Care equipment. So it's a platform, it's TYTO. So it has a camera, and then that's a throat, helps us see the throat, otoscope, and then a stethoscope. So what happens is we come on camera and then we say, "Hi, my name is Nurse Sheila. What's your name?"
Hi, my name is Liz Tuffland, and I just really am not feeling too well today.
Okay, Liz. And then I go to whatever the student information system is. The majority of our North Dakota schools and Maine schools are on Power School, Infinite Campus, but we have we do Skyward, EduTech. We learn whatever student information system the school has. But what we want to do is we want to look on the student information system so we can make sure if there is a health need that we don't know about. We just want to make sure we have a good picture before we start our visit. All right, Liz, well, let's start with taking your temperature then. So we're going to calibrate. So once in a while, we have to take the temperature in the room. So really what happens is the nurse runs the visit, but the school staff are our hands. The other things they are is usually they know the student. All right, ready? So this is a no-touch thermometer. We push the button and it stays about no further away than 2 inches. 97.3. Good news. So far you get to stay in school. So let's take a look at your throat. And you may have a little bit of a delay. We don't really have the delay when we do it, but between the platforms it's true. So blue dot to blue dot. Then we have a tongue depressor. All right, so then we coach the student through it. Open your mouth wide and say ah. Good job. So as school nurses, we really never have to know what's the matter. We just need to diagnose. We just need to know to give if things are not normal so we can give the parents the best information. So, all right, your throat looks good. Let's take a look in your ear. So again, blue dot to blue dot. All righty. Very good. And I'm going to turn the otoscope on. Very good. So then we can see that this is a good looking eardrum. And then we help do a little education with the kids when we're looking too. So there's a little bit of hair and they always point that out, believe me. And we say, you know, it's normal to have hair in your ears. That helps protect your eardrum. It's normal to have wax. And so we look and we say, wow, that's a great looking eardrum. Good job. All right. So the next thing we'll do is we'll look at the skin. All right. So we can adjust the focus from our side. There we go. We can adjust the light. We use this to look at rashes, wounds, hair. Do you want to show your hair? We know that probably Minnesota kids never get lice, but occasionally we see that in South Dakota. All right. And then we can also use this to check pupils. We're not going to check pupils today because we don't want Liz to get a migraine. And we found out, unfortunately, that that does it. So the last thing we're going to do is we're going to listen to the heart. And unfortunately, you won't be able to hear this. But again, blue dot to blue dot. But I just want to show you how it works. So we can use this to get a heart rate. We can listen to the heart and the lungs. And really, since what we've seen is since COVID, we've used this more often than not because we have just more anxiety that we're seeing in general. There you go. You must not have had your coffee yet.
Not enough.
All right. Or we can switch it to the lungs. And so the school staff just needs to know where to go and we can show them. It's what's called an amplified stethoscope. So it hears right through the clothes. We know that many of our kids wear hoodies. And so we make if they have a shirt underneath, we have them take their hoodie off. All right. And so then once we have done our assessment, and obviously we don't do an assessment for every visit, like where we use everything. It really depends on what the kid is needing. If it's a student with diabetes that comes on multiple times a day, a lot of times it's a fairly quick visit. Our visits usually average about 5 minutes, and then we help the school staff by doing the backside. And so what we'll do now is I'll say, Liz, I am sorry that you're not feeling better, but I think that it might be a day that it might not be 100% learning day, but I think it could be at least 90%. You don't have a fever, so that's good. Your throat's not red, your ear's not red. So I'd like you to try it. And, but who's the best grown up to call at your house? And we'll give them a little call and just let them know it's not being your best day. Or it might be that she had a fever or she had a red ear. So then the conversation would be a little different, where it'd be like, well, I'm going to try and get a hold of your parent guardian so that we can see if they can't come and get you home. Meanwhile, then we end the visit. We call the family members, we remote back into the student information system, call the family members, see who needs to go home. And then we call the school back and let them know what the story was, who will come get them, if they're going to stay, etc. So we're going to end this visit, and I'm going to stop sharing, and we can have you ask some questions. Thanks, Liz. Bye.
Bye.
All right.
Sheila, do you have anything else that you wanted to add, or questions or anything like that?
I think the other thing that I wanted to add is right now we have a grant from the Juvenile Diabetic Research Foundation and the Helmsley Trust. And so if you have a student that has diabetes in your school and the parents want to be part of the study, the cost of the program will be paid for 90% the first year, 60% the second year, 30% the third year. And we won't just take care of the student with diabetes, we take care of the whole school. But really what we're trying to show is that there is, not only do school nurses affect educational outcomes for our kids with special health needs, but they also affect medical outcomes. So we're following the hemoglobin A1Cs, which is really just it's a blood test that is a finger prick that covers, it shows what the blood sugar is over an extended period of time. And so what we're trying to show is that school nurses make a difference with that too. And so that really we can go to the Medicaid offices, we can go to some of the insurance payers and say, let's not just have education money, let's see if we can have medical money help pay for the needs of our kids in school too. So that is an opportunity that's available right now. We have 2 of our schools in Minnesota that are using that opportunity, that grant opportunity.
And that also gives your team an opportunity to work with school nutrition as well.
Yes, we do. In fact, with our kids with diabetes, we in the research grant, we have about 23 kids that we take care of that are kids that are just diabetics. We have probably around 35. So our littlest are 3 and our oldest is 10th, 11th graders that have some special needs. And so we work with the nutrition program in each of the schools to help figure out the carbs. And it looks different places. Some are quite robust and we do very little things. Some of our smaller school district, we work intimately with the food service to help figure out the carbs.
Well, one of the things that we want to mention is that this recording will be available on the MASA website on our masterclass page, so that if anyone would like to review it with their local teams or just review it for general purposes, yourself, that will be a resource. And Avel eCare will be, as one of our MASA partners, will be have a presence throughout the school year with our members as well. So this won't be the first time or the last. This won't be the last time that that you will be able to have an opportunity to visit with the Avel eCare folks.
Yeah, and if you have any questions, you can just reach out to me. I'm assuming that our contact information will be on that master webpage. And then I think that you can always have a visit like this where we show the equipment to other staff members so that they can help see that aha. And so in Maine especially, they have a good presence of school nurses. They just don't have enough of them. But one of the things that we found is when we show what we do and we visit with the nurses directly, they can see that it's how it could help. And I think that's a real important piece, is that it is about the kids, how we can do the best for the kids so that they can be good learners, but also how can we support the staff. And we've had some